On this week's episode of Plastic Surgery Uncensored, we're going to be doing our Q&As. All of you have written in some very interesting and helpful questions. I'm going to answer those questions with you alongside with my producer, Maria. So you want to tune in to make sure to see if your question is answered. All right, welcome to another episode of Plastic Surgery Uncensored. I'm your host, Dr. Rady Rahban. I'm joined in today with my co-host today is going to be Maria, my producer. Hi, Maria.
Hi there, how are you doing?
I'm great. So what we're going to be doing today is our Q&A. Every so often, what we'll do is we'll ask on our Instagram, which is drrahban.com. Not drrahban.com, our hashtag Dr. Rady Rahban. We ask a bunch of Q&As. You guys have been excellent in writing them in. So we've kind of grabbed a bunch of them and we're going to just answer them away until we run out of time. So Maria, fire away. What's the first question that people asked?
Okay, the first question from Gray V is, how does a surgically altered nose age versus a natural nose?
All right, Gray V, that's a great question. I like that question because it segues into what my philosophy is. What happens is your nose, of course, like every other part of your body is going to age. That's, nobody's body doesn't age. Your breasts sag, your earlobes grow, your lips get longer, your eyebrows sag. And so if you just don't do anything and you just age, your nose will also change. Your nose tends to get a little longer, you lose some of the collagen structure and it gets a little droopy, etc. But once you've operated on a nose, the traditional rhinoplasty, that is a rhinoplasty that's done most often throughout the world and has been done for years, is called a reductive rhinoplasty. So reductive refers to the fact that most patients come to the doctor and say, hey, I don't really like my nose. It's big, it's large, it just doesn't fit my face. I want something smaller, natural, something that's more balanced. I want something so, subtle. Well, obviously none of that makes any sense. Nobody knows what natural and subtle and smaller means. So your doctor goes in and starts to remove things. They remove the bone on the bridge of your nose. They remove the cartilage in your tip. They break the bones. They sew the tips together. And they do a lot of maneuvers in which the nose is reduced and made smaller, and hence the word reductive. But what we know about structures, let's take the Golden Gate Bridge. What we know about structures is when you remove support from a structure, so you go onto the Golden Gate Bridge, it's too big, and we remove 14 cables, what do you know about that structure? Over time, it will collapse. You go into the building and remove 4 or 5 pillars. What do you know will happen over time? It will collapse. So it should come as no surprise to you that a nose that has been operated on through a reductive technique, again, the technique most often used, over time will start to collapse. So I always use the picture of Bella Hadid in my office when patients come in to exemplify this, which is you start to see areas that collapse. So these are the classic findings that we see often in celebrities. The nostrils start to collapse, the nose starts to get pinched in, the middle area gets super narrow, the tip gets very refined. And so over time, the nose is more aggressively changing than if it would had you not operated. Now, the solution is modern day rhinoplasty, which is reconstructive, which is we make the nose smaller and cuter and all those things, but then we take structure, such as your septum, the cartilage, and then we use that cartilage to reconstruct and reinforce the areas that we weakened. So that over time, 5, 10, 20 years, your nose does not collapse and actually looks outstanding. So the answer to your question is obviously complicated, but there is definitely a right way and a wrong way. And if you take the wrong way, your nose will absolutely change much more dramatically than had you not done it. Next question.
Okay, so the next question was, do you make a 3D rhinoplasty imagery before the actual surgery?
Okay, so anyone who's come to me for consult or has heard me give my little spiel on rhinoplasties, you guys know that rhinoplasty is, I don't know, maybe 40, 50% of my practice. I am totally opposed to photomorphing technology or any 3D imagery, and I'll explain you why. If a 3D imagery or a photomorph would be reflective of what you would look like, I'm all for it. Why the hell not? Everyone that's getting plastic surgery, breast aug, tummy tuck, rhinoplasty, always wants to know what they're going to look like. The following statement goes, if I only knew what I'd look like, I'd definitely do it. Well, yeah, if I only knew that I would make money, I would definitely invest in such and such investment. But the reality is that nobody knows, nobody has a crystal ball. The photomorphing technology is done with the intention of giving you the idea of what you will look like so you can then decide, this is or isn't for me. But 100% of the times, you don't look like that photomorph. That's why it says, it's clear in English, it says, results may vary. What does results may vary mean? It means you will not look like this. So why the hell would I give you a photo of yourself if you're not going to look like it? Because as surgeons, we know that what you need in order to do your nose is confirmation. We need to lower your anxiety. And what will lower your anxiety is an image of your face, even though we're telling you in English, you won't look like it, because that allows you to pay and book on the dotted line. So let's ask this question again. Is the photomorphing for you as a patient, or is it for me as a doctor, a closing tool or a booking tool? So I am not a believer in photomorphing. I would 100% do it if I could say to you, hey, you're going to look like this. But the reality is that there's no way you're going to look like it reproducibly with every patient. So I think it's misleading. I think it's disingenuous. And I think that what you need to look at is hundreds of photos of that patient's work, that doctor's work. And that should give you an idea of what's possible, not what specifically your nose will look like.
It's almost a little bit like a bait and switch.
Well, what it is that the idea is that patients come in.
How you're going to look or how handsome you're going to look.
Right.
And then boom, take it away. And then when you're not satisfied, you're screwed.
Right. So what happens, imagine I'm building a house, right? My architect comes, he makes me all these plans. They do renderings. And then somehow on the bottom of the corner, it's got this like fine print. And I'm like reading it. I'm like, what the hell is this? And it says, results may vary. I would go to my architect and be like, what the hell are you talking about? Results may vary. What do you mean? Is the house going to look like this or not? Well, I mean, it's going to be in the ballpark. You would never hire that architect. If an engineer gave plans to NASA and did the same thing. So we don't tolerate results may vary. It's too ambiguous. And at the end of the day, if it were to be highly reproducible, I would do it. But I don't think you're going to look like it, so I don't do it. And if patients, it is what it is. Next.
Okay, so the next one is from Randy Stellar, or Stellar Randy. I'd like to hear your thoughts on necklifts.
So a necklift is a fancy word of saying a facelift. So bottom line is, as we age, 30 becomes 40, 40 becomes 50, 50 becomes 60, and so on. We all age the exact same way in different degrees. Everybody will eventually develop some loose skin in their neck. Everybody will develop some marionetting, meaning the line between the mouth and their jaw gets deeper. And everybody will develop a little bit of a jowl. Period. There's no human being on the planet that doesn't. It's just a matter of how much and when. When those three things develop, neck skin, marionetting, and jowling, the only treatment for them that really makes you go, wow, oh my God, you look so good, is elevating, lifting, and rearranging the skin. Now, what you call that depends on what flavor you like. Do you like the sound of a neck lift? Oh, I like neck lift. That sounds really like mild and reasonable. Do you like the sound of a mini facelift? Do you like the sound of a facelift? Oh no, I'm not going to get a facelift. Why the hell would I get a facelift? It turns out that when you remove skin in the neck, you have to move the skin of the neck outwards and towards your earlobes. You can't move the skin of the neck towards the chin because it makes a band. You have to move it, and you can't move it behind the ears, just like pull it behind the ear. You move it at like a 45-degree diagonal towards the corner of the ear. So we remove the excess skin of the neck through the line of the ear, in front and behind the ear. Now, the more skin you have, the longer the line. The shorter the less skin you have, the shorter the line. But by and large, it's just a verbiage, meaning it's a term, and most people would prefer the sound of a neck lift over the sound of a facelift. But in reality, a facelift is a misnomer. You are not really lifting the face as much as you are lifting the neck. Next question. I lost you, Maria. You're on mute.
Sorry there. Sorry.
Oh, holy crap. Oh, there we go.
No. So, okay, this one comes from Tiki Room Traveler. 120-pound loss after bariatric surgery. What BMI is ideal for skin removal procedure? Wow.
So first off, congratulations. Anybody that loses 50, 60, 70, 120 pounds, I've had patients lose 250 pounds, 300 pounds. Congratulations. That's awesome. So your question is a very good one. At what point should I consider surgery? The first and most important thing is not so much how much you weigh, but how long have you weighed that? In other words, you want to make sure you're stable. You got there. You didn't get there last week. You're not on your way down, but rather I got to a weight and I've been able to stay at that weight. The second thing is you want to be at a weight that you feel that you can maintain. So I got there and I can stay there and I'm happy. If you're at a particular weight and you're miserable, literally every day you're starving, every day you're unhappy, the truth of the matter is it's a matter of time before that weight is going to rise because you can't stay in a state of unhappiness. So the second thing is you want to make sure that you are happy at that weight. And the third thing is you want to have made enough weight loss that you have enough laxity and loose skin that you can have a really nice outcome. So you'll get to a certain weight loss after which losing more weight from a cosmetic standpoint won't make a significant difference. So every so often I see patients and they're in their weight loss journey. They come to me and say, oh my God, I want a body lift. And I'll look at them and be like, too soon. What do you mean too soon? I think you should lose another 20, 30 pounds. You'll have a better result. And every once in a while I'll have someone come to me and I'm like, oh wow, you could even gain 5 pounds. You could even gain 10 pounds. What the hell are you talking about? I've killed myself to lose this weight. You actually have lost too much weight. Your skin is so loose and you have no subcutaneous fat. What young, healthy person is just thin skin? So there is an appropriate amount of fat for an appropriate amount of skin where you will look your very best. That is going to vary from patient to patient. So I don't use any hard and fast rules of BMI, but rather examination. Know that if you're still overweight, you probably should wait, and know that you don't need to get down to like my weight in high school in order for you to have an amazing outcome. That's why you got to meet a surgeon who knows what the hell they're talking about.
So there's no specific BMI.
I mean, there's always guidelines. You can't have a BMI of 40, you know what I mean? But that's not useful. What's useful is that you got to be specific. I've seen patients with very low BMIs that still have fat trapped in their abdomen and they have skinny little legs. Mm-hmm. Right? Not everybody loses fat in the same distribution. The thing about losing weight that's so interesting is when you've seen 100 patients who've lost 100 pounds, you realize there's 100 different ways to lose weight. Some people lose all the weight in their face and some in their ass. Some people lose it all in their chest and their legs. Some people lose it all in their belly and not in their legs. I mean, it varies. So I have to see you.
Well, you know, they can also listen into some of your episodes where you've gone over with, you know, other body lift journeys of some of your patients. You know, you had one, it was posted November 20th of 2019, one patient's journey getting about a full body lift. So maybe listening to some of those episodes will also give them a little bit more encouragement also to do it. Great
plug, Maria. That's why you got to have your producer on the show. Plug the other episodes. Yes, we've done a lot of episodes on weight loss.
Three of them.
Yeah, well, it's a very common procedure nowadays. People are really getting themselves in shape. So congratulations. Next question.
I was really impressed by that one that we did, that she was a grandmother.
Rosie?
Yes. I was like,
Rosie was a tearjerker. Yeah, she looks great, and she's a rock star.
And she's a grandmother on top of that, to boot. Okay, the next one. Is there anything that can improve big masseter muscles without Botox or fillers?
So the question is there anything that we can do for masseter muscles? So masseter muscles are the main muscle that you use for mastication or chewing. They're in the angle or corner of your jaw. They become most prominent in people who do a lot of chewing gum and a lot of grinding. So most people today who present with large masseters due to grinding, because we live in a very anxious world. We're in great turmoil. And so people don't realize how much anxiety they have at night. My wife is one of them. So what you want to do is, everyone's raising their hand at home. And what you want to do is you want to reduce the amount of grinding that you do, because you're basically lifting weights. You're constantly cranking and biting down. So, night guards help and things of that nature. But once you've built that muscle up and your muscle and your masseter are huge and you have TMJ and a headache, and frankly, they're large and ugly and they look huge, really the only method, it's not even filler. Filler is adding volume. You want to weaken those muscles, and you can do so by doing a little bit of Botox injection and slowly and incrementally soften those muscles so they're not cranking. What you'll notice is cosmetically you'll look better, but more importantly, you won't have as much ear pain, TMJ, or headaches usually.
Good. Well, we have a question from Cam Crushing It. She says, he says, I think, have you ever done tummy tuck on a patient that has had DVT? But don't answer that. Let's go to a break.
Okay. Let's do it. Let's take a break. We'll be back. We'll answer some more of your questions. Make sure to tune into the second half of our Q&A. All right, welcome back to the second half of our Q&A session. I'm your host, Dr. Rady Rahban. I'm here with Maria, my producer. And the question that was asked right before the break was, have I or can I do a tummy tuck in a patient who's had a DVT, a deep venous thrombosis, AKA a clot, a blood clot? And so the answer is you can do it, but you just need to do your homework. A blood clot is when you develop fluid or venous stasis in one of your main veins. It can be behind your knee, it can be in your groin, and that clot then can travel and potentially be fatal, and you get a pulmonary embolus and you can die. Surgeries, plastic surgery is one of them, orthopedics is another. Certain surgeries are at higher risk than others, and a tummy tuck in general is considered slightly higher risk than other procedures than, let's say, a nose job for getting a DVT or a blood clot. Your surgeon needs to do all the things that are designed prophylactically, that means in advance, to prevent you from getting it. So forget about the patient who has the DVT. Every patient I do a tummy tuck on, every patient, I give them blood thinner before the surgery. That's what's recommended by the Pulmonary Society of America. In addition, they wear leg squeezers or compression stockings prior to anesthesia induction. And lastly, they get up and walk around the same night they had surgery. In that regard, the risk of DVT or blood clot is really low when you take those precautions. Now, if you've had a history of a clot, the question then, of course, that begs is why? If it's because you have a genetic predisposition, you need to get worked up. It's because you had trauma, then we need to know. So it can be, and I've done tummy tucks and other surgeries in people with blood clots, but we usually have them see a hematologist, and that hematologist clears them or makes sure that they're safe to undergo surgery. And I've done many successful surgeries in people with history of blood clots without any incident.
Well, here's another one on tummy tuck. This one comes from Marinaz 602. If someone has a tummy tuck and hates their belly button, can they get a revision done afterwards?
Okay, that's a great question. So I make a huge deal about belly buttons. I make a huge deal about everything, but I make a huge deal about belly buttons when it comes to tummy tucks because let's be honest, there's really two main things that people care a lot about. One is the scar in the bottom of the abdomen, and the other is a belly button. So how low and how nice is my scar, and what does my belly button look at? So when you go online and you're looking at photos before and afters, you kind of can't even see the scar because even physicians with terrible scars, even physicians with really high scars cover that up with sort of midriff bathing suits. Yes, it doesn't look as good as a low-riding bathing suit, but at least it's covered. What you can hide is an ugly belly button, and there are thousands of versions of that. Big round ones, small tiny little ones that are scarred, one where you can see the stitches. I mean, there's 100 variations of hideous belly buttons. Once you have a tummy tuck and your belly button is ugly, it's unlikely you're going to wear a two-piece. You're likely going to wear a one-piece, in which case it's kind of like almost defeats the purpose of having had a tummy tuck. And the truth of the matter is that when you're at any poolside, any barbecue, most people will be able to identify an ugly belly button that's surgical than not. So that's why you got to do it right the first time. Now, this question is about, well, I already did it. Thanks so much. And it's ugly. What do I do? It can be improved. It can be improved, but sometimes it cannot be. And most times, even when it's improved, it's minorly improved. Hence, there are certain things that you really got to get right the first time. And some things can be revised and perhaps better. So the answer is you can improve it, but it never looks like a really well done belly button the first time.
So lesson to be learned, be prepared before you go into it.
Yeah, I mean, you can go online. There should be no surprises. This is one of those things where you're like, oh my God, I didn't know. I mean, there's like 1,000 photos online. You should be able to see it. Next question.
Okay. This one is, do you prefer a lollipop lift or an anchor?
So that's a great question. So the question is, what type of lift do you prefer? So let's start by defining lift. Lift means that my breasts are saggy. I like the size of them, but they're just saggy and I want them elevated, the nipple lifted up. A lift is a skin-only procedure. You're only removing skin. You're not removing breast tissue. You're not doing anything else. So shape, you change through lift. Size, you change through an implant or a reduction. So once you decide I want to get a lift, the question is, well, where's the skin? How do you remove it? So the amount of skin you remove and the pattern in which you remove it depends on how much sag you have. So if you have a little bit of sag, a moderate amount of sag, or severe amount of sag, will determine the type of lift. So we have donut lifts. That means a lift where the incision is around the areola. You have a lollipop lift where the incision is around the areola and down the middle of the breast. And then you have an anchor type lift where the incision is around the areola, down the middle of the breast, and within the fold. And the answer is you don't pick the lift. The lift is chosen for you based on the anatomy you present with. Every person comes with a certain degree of sag, and that sag will dictate how much lift, what kind of lift you need. The worst thing you can ever do is go into a surgeon and say, hey, listen, there is no way in hell I'm having X, Y, and Z. I will only have this. And the surgeon will be like, I'm not going to lose this patient. Okay, we can make it work. I mean, just listen to the conversation. We should be okay. We'll get away with it. So I am dogmatic that you need what you need. So the answer is you need an anchor or don't do it. The answer isn't you need an anchor, but since you don't want that one, well, shit, let's just do the other one and it should be okay. It's better than what you have. I'm not a second base, third base guy. It's either home run or just don't bother playing. So you can't pick your lift. Your lift is determined by your measurements.
Now, here's one that I just spotted from McKaylee. What type of breast lift ages the best?
There is no such thing as a breast lift that ages best. You need a lift. The lift resets it, and your aging is based on your anatomy and how you do. So you get a lift. It looks amazing. Then you gain 60 pounds, lose 40 pounds, and have 3 more children. Well, of course the lift's going to go in the garbage. So lifts don't determine how it age. Lifts reset you to where you are, and how fast or how quick you age depends on your environment and your genetics.
And we have this one. How long is the recovery for breast lift and implants? As you can tell, there's a lot of questions about breast lift.
The recovery from breast lift and implant is the same recovery from tummy tuck, with the same recovery from rhinoplasty, with the same recovery from all recoveries. Recoveries are broken into what I consider some basic fundamental sort of timelines. Usually it's 1 to 2 weeks from work. Usually it's 6 weeks from exercise. It's usually 3 to 6 months before I feel like a rock star. That's just human body healing. You get your nose done, you get your breast done, you get your eyelids done. 1 to 2 weeks off work, 6 weeks before I really get into exercise, 3 to 6 months before I feel like a rock star. That applies to almost all wound healing across the board.
Okie doke. And I have your question. What exactly is a mini tummy tuck, and who is considered an ideal patient for one? I think I know this answer because
yeah. I hate the word mini. Mini is a gimmick that people created in order to trick patients who are afraid of doing what they want to do. So love the sound of a mini facelift, a mini tummy tuck, a mini lift, a mini results, mini surgery. So a mini tummy tuck essentially is for people who have, number 1, no bulge, 0. Their abdomen is flat as a board. 2, the skin from their belly button to their xiphoid between their breasts is smooth and tight. And 3, have a lot of loose skin, wrinkly, crepey skin from their belly button to their pubis. In other words, a woman who has crepey, loose skin near an area of a C-section is a mini tummy tuck candidate. All you're doing is an incision larger than a C-section, and from which you're removing excess skin below the belly button. What can you not fix, which is pretty much 90% of patients? You cannot fix loose skin above the belly button through a mini. You cannot fix muscle adequately and get a flat stomach when you have all kinds of diastasis and bulges and whatnot. Do people try it? Do people do it? Sure, and you get shitty results, and you can see that online. But if you want a home run, again, a home run, You need the surgery you need, and seldom are you a candidate for a mini tummy tuck. Seldom.
Okay, let me see. There's more questions here.
Fire away. I'm on a roll.
Yeah, there's a question here is kind of, I thought it was odd. What happens to the excess, wait, let me see. I just lost it. I had it here. To the excess fat and skin after surgery?
We throw it in the garbage. We throw it in the garbage.
Yeah, because
there was a guy in Beverly Hills that was notorious. He was on the news. He used to take the liposuction stuff that's in the canisters and he tried to make fuel out of it for his car.
Oh my God.
Yeah. We can say, I think safely, he's either arrested or he's in another.
Psycho.
But we throw it in biohazard. We don't just throw it in the regular garbage can, but we dispose of it with other tissue.
Okay. We have a lot of questions here, but I'm not sure. I'm trying to see, can anything be done for, there's a good one here. Can anything be done for chest wrinkles? I think I know the answer to this one too, but let's see what you have to say.
Chest wrinkles are referring most likely to the décolletage in a woman. Again, like some things have great treatments and some things the treatment should be prevention. You want to reduce the amount of wrinkles you get in your décolletage and before you get them, because there's no real good treatment for décolletage wrinkles. So first and foremost, you want to stay the hell out of the sun. The skin on your chest is much thinner than the skin elsewhere. And so you get, when you fry your chest and it looks like beef jerky and you've been in the sun for, years on end and you have all those freckles, and then don't be surprised that your décolletage is all wrinkled. So sun is super damaging. You can do things for resurfacing like light peels and whatever. Ultherapy touts to do some work on the décolletage. But the honest truth is that once you get wrinkles in your décolletage, you're pretty much, there's not a lot that can be done that's going to be like, wow, oh my God, look at that. It's not like a neck lift where you get, or a facelift or something. It's kind of limited. So I would suggest just making sure you don't get a bunch of wrinkles. It happens a little more in women with large breasts who sleep on the side and it pulls their breasts. Some women wear bras to sleep and have sort of like a breast pillow and things of that nature. Those things probably help a little, but I think the biggest culprit is generally your genetics combined with sun.
Yeah, I'm 57, and I can tell you when I was 15, my mother would always tell me, put on creams, put on moisturizer from the age of 15. And I kept thinking, why at 15, why would I need to put it? And I can tell you, to this day, I'm very happy that I did it, because I don't think I have the amount of wrinkles. I mean, I have wrinkles, but not anything close to what I.
Of course, 100%, because Jesus Christ, you take care of your plants, you take care of your garden, anything you take care of does better than if you don't take care of it. And your skin is a organ. And if it gets dehydrated and desiccated like tree bark or beef jerky, it's not going to look as good if it's hydrated like something else. I mean, we just ignore it because we don't think of it as the way we think of other things, but it needs love just like anything else.
Right. Does cool sculpting help with banana rolls cellulite? I know that answer too.
So you see, Maria, look at that.
You need to listen to more of these podcasts.
That's okay. We need content, so this is perfectly fine. So let's start out with the items. So let's just tackle cellulite to begin with. There is no known treatment to this point in time at all that consistently, reproducibly, and effectively reduces cellulite. So I promise you, tomorrow, there will be another 30 machines and 30 creams and 30 treatments, because of course, there are three things that if we can find a solution for, whoever figures it out is going to be a trillionaire. Number one is cellulite. Number two is going to be scars, right? And number three is going to be stretch marks. If you find the solution to those three things, trillionaire. So no such thing exists. Now, cellulite can be made better or worse, but it's never going to go away. Now, cool sculpting doesn't make any cellulite go away. It removes fat, and yes, it works. And it removes fat in certain areas, in certain people better than others. The banana roll is a very difficult place to get rid of, and I really caution you to try to remove fat from underneath your buttock, because what it can do, it can cause the buttock to fall. And there's people who get liposuction in their banana rolls and regret it majorly, especially in women. Women don't look good with a really deep buttock crease. That's a male aesthetic. So you want to be cautious in the banana roll. cool sculpting in general works, not so much in the buttock roll, and forget about anything in regards to cellulite. Next question.
Well, no, I think we've answered them all, but I wanted to read you a comment that they posted from Dolphin.
If it's negative, I don't want to hear it.
No, no, you don't really. I haven't seen one negative post on your podcast.
I think it's because we're deleting them all.
No, we don't. That goes through Apple. But this one is from Dollface97. It says, I've been doing so much research lately on breast augmentations, and not one doctor has made the statement that gummy bear implants cannot rupture, but do have a chance of moving, repositioning over time. I found that very informational. I already had my heart set on gummy bear implants, and that just made me even happier. I love this podcast. It would be lovely if you could do more episodes about breast augmentations, maybe even have more patients on with their experiences or just tell stories about them. So I will tell you, breast augmentation seems to be the big topic for most.
Well, I mean, listen, cosmetic surgery is always going to be popular. There's only two ways to go about it. Either go about it educated or go about it ignorant. I mean, that's just a reality. And the topics that are always going to be interesting are the ones that most people do, right? They're going to do their nose. They're going to do breasts. They're going to do tummies. Of course, we do eyelids and ear pinnings and chin augs. And, I do all kinds of interesting and very effective things. But those are really the crux of, at least a lot of people today are doing. And they're highly effective with amazing outcomes if you do them right. So I'm glad that people are listening. I'm glad that they're finding it interesting. I sure as hell don't want to be sitting here on a Sunday recording all this if no one's listening. And more importantly, I'm happy that they like it because, well, that's why we do it.
Yeah. And if you hear an answer or something, a question, look at the library of the episodes. There's a lot of these topics that have been.
How many episodes do we have now? Like 60?
Yeah, probably over 60.
Okay, guys. So go ahead. What I ask of you is this. When you're listening to this, number one, go check out the other episodes. You'll find a lot of useful content. Number two, please, 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 please share this with friends and family. It really helps because, as you know, with any kind of movement or any kind of process, the more people that are on board, the more powerful it becomes, the more people hear it. And I love to hear your comments and reviews and suggestions. So participate. That lets me know that this is not all for nothing. So I hope you guys enjoyed yet another episode of Plastic Surgery Uncensored. And as always, make sure to join into our next show, as I'm sure whatever topic we're talking about, it's going to be interesting.